And we know that journey to motherhood could be impacted by many things. That includes medical treatments. So we want you to meet a special nurse who works with kids at Riley in a very unique role.
2 weeks before I graduated high school is when I was diagnosed with leukemia.
For Riley Hospital nurse Rhea Watson, the oncology floor is not just her workplace. It's a place that saved her life more than a decade ago.
So that's where I get my huge passion for being able to counsel these families.
She not only cares for kids and their families, Rhea provides mentorship and support from someone who's been in those shoes.
It's hard, and there's not a lot of people who understand going through cancer at such a young age and getting all these toxic chemos, and so it's hard to even talk to anybody about your struggles.
And now she takes her experiences a step further as the fertility coordinator, where she focuses on fertility preservation in cancer patients. But fertility may not be top of mind when you think about kids with cancer.
I mean, what's crazy is we've actually counseled on a 6-week-old baby before. We can help any of these kids.
Procedures where doctors can take a tiny sample of a sex tissue from a baby and freeze it, and then reimplant it in the future or use it someday for IVF. They also do egg and sperm banking before chemo for post-pubertal patients. Some families are overwhelmed, but to others, talking to Rhea provides positivity in a dark time.
We're there kind of being the hope of the situation.
In the moment of a devastating diagnosis, she helps families focus on the future and look long term.
We are very hopeful, and we think your kid is going to make it to the future. So let's talk about their fertility.
Right now, Rhea says there's a lot of unknowns as to how much chemo can affect future fertility, but it's a topic she didn't learn about prior to her own treatment.
Really, as soon as I was diagnosed, I was treated the next day.
Rhea started treatments at Simon Cancer Center as an 18-year-old, eventually transferring to Riley, where she beat cancer, but struggled with the same things many of her teen patients now face.
So that's where I get my huge passion for being able to counsel these families and tell them exactly what their risk is, and if they are in that intermediate ground, we might be able to do something for them to help with their future fertility.
She said she tried to stay positive about her own chances to have a family of her own someday.
I just didn't know what my journey looked like.
But it's something that's been in the back of her mind for some time.
I had talked to my husband. I had told him, even before we got engaged and married and all that, I had told him I didn't know what that looked like.
As Rhea and her husband, Zach, tried to start their family, a little fear from her past crept in. They decided to seek the help of a fertility specialist. And this past fall, she planned to call a doctor on a Wednesday.
And I took a test on Tuesday night just to rule it out. I didn't think I was pregnant at all. And I was like, okay, I'll just take this, rule it out.
But then she saw something unexpected.
I took it and I was like, oh my gosh, this is positive.
An answer to their many prayers, a baby boy due this summer.
But it is exciting to have a Mother's Day where it's okay, next year I'm going to be holding this baby.
Her cancer journey and recovery now coming full circle. But her story doesn't end here as a mommy-to-be.
It's so hard to understand why you go through what you go through. And for me, I had to find a purpose and I had to find a why. And that's what really brought me into oncology and especially into the fertility preservation program here at Riley.
Helping kids just like her have kids someday too.
And we want to thank you to Rhea and Zach for sharing their story with us. A happy early Mother's Day to her and all the moms out there watching this morning.